everybody. Welcome to MedPod Today, the podcast series where MedPage Today reporters share deeper insight into the week's biggest healthcare stories. I'm your host, Rachel Robertson. Today, we are talking with Shannon Firth about the killing of ICU nurse Alex Preddy in Minneapolis. Then I will share my reporting on ChatGPT health and what doctors think about it. Jody McCreary will close out the episode by breaking down Robert F. Kennedy Jr.'s claims about fermented foods and weight loss. Sadly, there's more disturbing news out of the Trump administration's immigration crackdown in Minneapolis. Federal immigration officials killed another person, Alex Preddy, who was a 37-year-old ICU nurse at the Veterans Administration. Shannon Firth is here to share what we know so far about Preddy's killing. Shannon, what can you tell us about what happened?
So, Rachel, there are conflicting accounts. The Trump administration initially claimed federal officers were conducting an operation and fired, quote, defensive shots after a man with a handgun approached them and violently resisted when officers tried to disarm him. But as multiple media outlets have reported, in bystander video footage, Preddy is seen with a phone in his hand, never a weapon. Preddy was carrying a firearm, which he had a permit for, but that was removed from him before he was shot. According to the Associated Press, use of force experts said video from bystanders undermines claims that the officers fired, quote, defensively. There's also no evidence to support Border Patrol senior official Greg Bavino's claim that Preddy intended to, quote, massacre law enforcement.
Wow, this is really troubling overall. So what has the response been from the healthcare community?
I agree with you, Rachel. It's truly a disturbing incident, especially in the wake of the shooting of Renee Good just a few weeks earlier. The day before Preddy was shot, I spoke to Janelle Johnson-Thiel, a nurse in Minneapolis, and she described her city as like a militarized zone. She said that many people were worried about things escalating further. Preddy's friends and family are devastated. A nursing student who knew Preddy wrote a tribute to him on social media. She described him as a healer, someone who was, quote, incapable of causing harm, and said she was unsurprised to learn his final words were, "Are you okay?" A Minneapolis physician I spoke with, Dr. Jana Gewurtz O'Brien, also stressed that his final moments reflect an act of bravery. He reacted the way any nurse she knows would have in a similar situation, she said. Preddy saw a woman being shoved, and he ran to help her, O'Brien told me. The American Nurses Association condemned the violence and has called for a full and unencumbered investigation. And the American Federation of Government Employees, of which Preddy was a member, also called for a full, transparent, independent, third-party investigation into his killing.
So where do things stand now?
So Bavino, the Border Patrol official who said Preddy was intent on a massacre, he's been removed from his post. And according to the New York Times, an initial report from the Department of Homeland Security has walked back some of the claims made by the Trump administration. For example, it does not state that Preddy at any point brandished a weapon. Governor Tim Walz has spoken with President Trump and said that Trump has taken a, quote, collaborative tone. And despite the president continuing to blame Preddy for carrying a gun, which he was legally permitted to do, he has said there are plans to, quote, de-escalate a little bit. National Nurses United, the largest nurses union in the country, is hosting a week of action in honor of Preddy with vigils and other events in over a dozen states.
Thanks so much for your coverage of this tragic situation, Shannon.
Thanks, Rachel.
Reporter Jody McCreary will take the host seat for this segment.
So ChatGPT launched a health-specific version earlier this month. Rachel talked with doctors about how the platform may shape patient-doctor interactions, and she's here to fill us in. Rachel, start off by telling us what ChatGPT Health is.
So, according to parent company OpenAI, 230 million people are already asking regular ChatGPT health-related questions each week. And so the company worked with more than 260 doctors over 2 years to build the health-specific platform. So ChatGPT Health largely works the same as the regular version, but it has enhanced privacy protections, and the queries aren't used to train their foundation models. Plus, users can actually link their medical records and information from wellness apps and like wearable health trackers so that ChatGPT Health can consider those in their responses. The company gave a bunch of examples of how to use the platform, like, coming up with questions to ask the doctor, interpreting medical scans, developing workout or nutrition plans. Here's what one man says in the promotional video. He says, quote, "My doctor's appointments have evolved much more into action planning than they have information gathering. Empowering patients, they have better health outcomes." While the company says that there are enhanced privacy protections with ChatGPT Health, it's worth noting that OpenAI did tell me that ChatGPT Health isn't covered by HIPAA.
So what are doctors saying about it?
To be honest, the response was more positive than I was expecting. We hear a lot of gripes about Dr. Google and patients using internet resources to diagnose themselves, but the doctors I spoke to were pretty optimistic about ChatGPT Health. Henry Baer, a resident physician at Wills Eye Hospital, told me that his patients come in with more information and more formed opinions on what they think is going on with their bodies and their conditions. The quality of artificial intelligence and large language models has improved drastically in the past few years. Baer said that developing a health-specific mode is, quote, "a signal from the company about how confident they are in the robustness of their answers." Rohaid Ali, a neurosurgeon at Mass General Brigham, told me even regular ChatGPT has helped many of his patients improve their health literacy. He also said that physicians use it a lot too, which speaks to its usefulness.
What about the risks?
Yeah, there are a ton of risks to consider. While ChatGPT Health isn't poised as a medical decision maker, patients can and are using it that way. Anytime data from medical records or wearable health technology is linked up, there are privacy concerns as well as questions about how accurately that data will be interpreted. Algorithms are complicated and constantly evolving. Plus, not all healthcare institutions are keeping up with artificial intelligence tools and creating guidelines to the same extent, so there's a lot of variation within the healthcare industry. Other companies are coming up with health-specific AI products too, so it's clear that this is a topic we're going to continue to see influencing healthcare.
Thanks, Rachel.
Thank you, Jody, and I will take the host seat back for your segment now.
All right.
Up next, a massive weight loss claim from Robert F. Kennedy Jr. The HHS secretary says he lost 20 pounds in 20 days, in part by eating foods like yogurt and sauerkraut. They're called fermented foods, and recently they've been getting a lot of attention. But are they really that good for you? MedPage Today reporter Jody McCreary is digging deeper to find out. Jody, first of all, where did this recent boom come from?
Well, Rachel, it started when Kennedy told USA Today about his weight loss. He said he's following the carnivore diet and only eats meat and fermented foods, and claims to have dropped an average of a pound a day. But the diet experts I talked to say that just doesn't add up. They say losing that much weight that fast can't be due to fermented foods alone. There are other factors, including the calorie count, water loss, and wider changes to what you're eating.
What exactly makes a food fermented in the first place? And can those types of foods even lead to health benefits? And if so, how do they do that?
Those are good questions. Now, fermented foods have been around for thousands of years. They're produced when microorganisms like bacteria or yeast break down sugars. Now, the main example is yogurt that has live cultures. And in some cases, those foods can add more live microbes into your gut. It's a two-pronged approach. When you eat fruits, vegetables, whole grains, and foods with fiber, you're feeding those microbes that live in your gut. Now, those fuels are called prebiotics. And then when you eat fermented foods that have live cultures, you're bringing in probiotics. That adds even more of those good bacteria that pass through. Now, the end goal is diversity, with lots of different bacteria in your gut.
Okay, so what does the science say about that?
Well, there is some research that points to health benefits. Another expert I spoke to says much of the evidence is observational, but in nutrition research, that's common. He says clinical trials tend to be smaller and shorter. But he pointed to one study from 2021. Researchers from Stanford found a diet high in fermented foods increases the diversity of the gut microbiome. In other words, more of those good bacteria we talked about earlier. But the key is balance, with gradual changes in making fermented foods part of a diet that's balanced. If you're looking for a miracle to drop fat fast, well, this isn't it.
Well, there goes my plans to chug yogurt after this. Thanks, Jody.
Thanks, Rachel.
Before we go, a really quick update on the measles situation. We saw 176 new measles cases last week and 308 the week prior. Right now, the biggest hotspot is South Carolina, where cases are exploding. MedPage Today is visualizing measles spread each week, so bookmark our map and stay tuned for our weekly updates. And that is it for today. If you like what you heard, please leave us a review wherever you listen to podcasts and hit subscribe if you haven't already. We will see you again soon. This episode was hosted and produced by me, Rachel Robertson. Sound engineering by Greg Loud. Theme music by Palomar. Guests were MedPage Today reporters Shannon Firth, Jody McCreary, and Rachel Robertson. Links to their stories are in the show notes. MedPod Today is a production of MedPage Today. For more information about the show, check out medpagetoday.com/podcasts.